A most pleasant good afternoon to all. I would like to, on behalf of the team, make the apologies for being late because there were one or two activities in the ministry that I had to attend. So I must apologize to the press and to the people for the unusual untimely nature of this broadcast. Thank you, Premier, and a very pleasant good evening to everyone. As the Premier announced, we're about to enter a new chapter of the territorial reopening process where passenger aircraft will be permitted to land at the TB Letcham International Airport to facilitate the re-entry of BVI nationals and permanent residents during the first phase. Having largely contained COVID-19 transmissions within the territory and cautiously managed the internal reopening process in a manner that provides public safety, this border reopening process must also be carefully handled in order to guarantee or guard against an upsurge in the virus. A precautionary approach remains important in the context of the 4.8 persons of the cases and 319,000 deaths recorded globally, with approximately 2 million recoveries. Close to 21,000 positive cases are recorded in the Caribbean, with 784 deaths and 9,450 recoveries. After testing 161 persons locally, with lab test results from CAFA, the BVI has recorded no new cases that we have to report. As I previously announced, we have 8 to date. We had 6 persons have now been totally recovered, and we have 1 death and 1 active case as the person remains in isolation. Given the unrelenting nature of this pandemic, the border reopening process requires that we consistently implement a comprehensive range of measures to detect, contain, mitigate, and manage the disease. In simple terms, this means that every person coming into the territory will be subject to pre-arrival screening or health screening on arrival, ongoing monitoring during a 14-day mandatory quarantine period, and testing to confirm their COVID-19 status, albeit hopefully negative. Persons may be allowed to quarantine at home or in alternative private accommodations, or may be placed in a government quarantine facility for a duration of the 14-day period. As previously stated, persons with suitable accommodations for home quarantine will be given priority in the first phase of re-entry. Quarantine in homes and other private locations can only be permitted after the properties have been inspected and approved by the Environmental Health Division. The placement will be confirmed as part of the re-entry registration process. This form will be placed online come Monday. Each person who has been approved to quarantine in a non-governmental quarantine facility will be required to adhere to the established quarantine guidelines. The person of family being quarantined must be housed separately from other family members, friends, or associates. No visitors are allowed at the home or other quarantine location. Each bedroom being used will be well ventilated with a window that can be opened to enable airflow in order to keep clean air moving through the room. Instructions will be provided for individuals to self-monitor their health for the next 14 days and immediately report to the surveillance officer if they develop symptoms suggestive of COVID-19. This will be followed up on many calls from the surveillance team. Each individual will be tested on day 14 and will be discharged from the quarantine provided that they have not come into contact with a COVID-19 case and laboratory test results are negative. Once cleared, the individual will be provided with the quarantine release certificate and, if necessary, a return to work form. Persons who wish to have their homes or other properties inspected for the purpose of accommodating someone who is expected to return home within the next few weeks are invited to call the government's Customer Care Center at 494-3701 and provide details of the property. The period leading up to June 15 will also provide an opportunity to secure additional properties for government quarantine accommodations. With the launch of the electronic reentry registration form on Monday, 25th May, nationals and permanent residents currently overseas will be encouraged to submit information that would give us a better understanding of the number of persons to be accommodated over the upcoming 3-month period. This information will also help to determine the scheduling of flights. The successful implementation of the COVID-19 phased restricted border reopening plan is conditional on the adequacy of screening capabilities, testing capabilities, quarantine and isolation facilities, no community transmission or spikes in infection, as well as the robustness of the territory's health system to deal with COVID-19 related issues and deliver essential health services. Significant investments have been made to strengthen capabilities in all these areas by the government of the Virgin Islands, private donors, and the United Kingdom government. Today, I want to again highlight and express appreciation to Public Health England for its generous contributions of medical equipment and supplies that have helped to place the BVI Health Services Authority in a strong position to meet the future demands of COVID-19 testing and treatment. Persons experiencing flu-like symptoms or needing any COVID-19 related or any other medical consultation can call the medical hotline at 852-7650. I am also grateful to the United Kingdom government, OECS Commission, and the Cuban government for supporting our requests for assistance from medical response teams from Cuba, and we await the finalization of the terms of agreement between the parties. We would give a comprehensive and detailed report of all expenditures that have been placed under the guardianship of the Ministry of Health in all aspects of it. We continue to monitor all aspects of COVID-19 so that we can continue to keep our Virgin Islands safe. I have stated before, I'll state again, because we kept the numbers down, there would be a lot of details and speculations as to what all we could, we should not, or could not have done. If the numbers had spiked, if the numbers were plenty, we'll have a different conversation. I'd rather the first. So I thank you very much.